her little guide's really good. So for the IFC for both of them on these units, first of all, you're gonna pick IFC unless for some reason they have to only do it at home. Then you give them the TENS unit. But the parameters are the same for IFC and for TENS. You're looking at 80 to 110 pulses per second. That's also called like beats, I believe, on some of the machines. So don't let the words mix you up. And then you're just gonna do an intensity that's strong but comfortable. And you're not really gonna adjust the pulse duration or anything except on those units. It should be set on these. So if you go to the electrotherapy and then manual and you do the IFC and you select your pads that you're going to use, channel 1 and channel 2, it already has 80 to 150. We're saying technically according to that 80 to 110 is what we're looking at, but you can leave it at this because obviously the machine, they did their research and they're saying that that's what's best. This doesn't have the option for sweep. If you had the option for sweep and you're trying to decrease pain, it works better because there's less likely a chance that they're gonna like adapt to it or become used to it if it sweeps because it moves the hot spot around. On this one, when you do the IFC and it comes on, if you want, you don't have to, but you can hit edit. The sweep's already on, 80 to 150. If you want, you can change it to 110. The frequency can either be 4,000 or 5,000, it doesn't matter, but 5,000 is gonna feel a little bit more comfortable and it might possibly get a little deeper. Just because it's a higher frequency can pass through more tissues without it hurting, so you can be at a higher intensity probably. And then the sweep just means that if I have 4 pads, and say that the 4 pads are placed around like this box, I had 1 pad here, 1 pad here, 1 pad here, and 1 pad here, they're all gonna interfere at this spot. If I don't have sweep on, the interference just occurs right in the middle. If I have sweep on, these send different wavelengths or intensities in order to move the hot spot throughout this entire area between the pads, so you're less likely to like become adapted to it and not feel it and have to turn it up more. So you want sweep if you can, because they're not gonna lose the feeling of it as quickly. That's for IFC. For TENS, you're gonna use the same parameters as IFC, but it's not gonna be as effective because you don't get the interference. So some of your superficial tissue is gonna start to feel it, and therefore you can't use as high of an intensity. So whenever you turn it on, the pulse width for these, you want a shorter pulse width. So you're gonna set that between 50 and 100. Whenever, let me open this up. How do I open it? Oh. All right, so you can hit the mode. Pulse width is gonna be between 50 and 100. Why? So anywhere between 50 and 100. And then I'm gonna leave it on normal. Pulse width is between 50 and 100. The rate is between 80 and 110. So let's just say we set it at 90 because that's in between. And then the time, whatever the time parameters are on the study with the SPT doc I would use, I think it says greater than 15 or something like that. But normal for the TENS unit, 80 to 110, a pulse width between 50 and 100, and then you just set the time. And then you're gonna turn it up to an intensity that's strong but comfortable, just like you did with IFC. So all the parameters are the same. If you hit mode, then that's gonna switch between modulation, SD1, SD2, burst, normal. Burst would be a little bit more comfortable, so if for some reason they were having issues, you could put it on burst, but then leave everything else the same.
What kind of issues?
Like if it was like just uncomfortable, the burst could make it less uncomfortable and you could keep the same intensity that you had. So then if you hit set, it'll start to flash on the pulse width. You can go up or down. Then if you hit set again, it'll change the rate, which is the frequency. And you could change that anything between 80 and 110. And then if you hit set one more time, it'll go to the time, and then you can adjust that up or down. And then you would just crank the intensity on the top. And then it just turns off when you turn it all the way down. If for some reason pain is one of their big complaints, even if they also have swelling with it, you can just say, well, pain's a big complaint. I'm going to treat the pain and I'll put ice on it to reduce the swelling. Or if it's tight, I'll put heat on it to reduce the tightness. but IFC for the pain. And then if it's a strength or motor problem, then you're just going to use the NMES or Russian. NMES is just if you're not using a specific form of NMES, you just call it that. Russian's just a specific form of NMES. So whenever you're doing something for strengthening, you're going to look at 30 to 50 for the pulse or the frequency or the beats, whatever term you want to use for it. It just depends on the machine. If you go over 40 though, you run the risk of fatigue. So I would primarily stay within 30 to 40 unless you specifically have like a hypertonic muscle or a spasm that you're trying to fatigue out. So if you go to electrotherapy, manual operations, and then you go to NMES, if you only need one channel, so say you're just doing tib anterior, you're going to set this to 40 or less if you don't want it to fatigue. Your on-off time, you have a few different options. You can say 1 to 3 or 1 to 5. Just depends on whatever you want. And your ramp's usually going to be 1 to 2 as well, unless for some reason you need no ramp time. And then you're going to set this at least 250 up to 400. So I usually just put it at 300. I leave the ramp at 2 just so that way they have some comfort. And then you would take it and you're going to crank it up. You want 50% of the contraction to reduce atrophy, and you want 70% of a contraction, like what would be a max contraction, in order to improve strengthening. So you could have them contract all the way, you can feel it, and then whenever you crank all the way up, you can feel what was assumed to be half of that with your fingers, or what they say that feels like half of whenever I fully contract, or that feels like 75%. Then you can leave it there and you're going to have them contract with it. For the NMES, most of it's going to be 8 to 10 contractions. Like that's your treatment. You're just doing it 8 to 10 times. After that, they run the risk of fatiguing. For this one, you're just going to do symmetrical biphasic. And you're going to set everything the same. So we said 30 to 40. So 35. It's usually what it's set on when you click on it. Phase, 250 to 400. Set on 300. Perfect. Don't worry about burst. Don't worry about frequency modulation. Amplitude modulation, don't worry about it. You'll change continuous to whatever you want. Let's say we said 10 to 3 or 10 to 50. And then you're going to do 8 to 10 contractions. So you can just take the time and you can just increase it to like 30 minutes. That way you don't run out, and you just hit start and you're going to count the amount of contractions and do the exact same thing. That's going to be NMES. All right, so for this, the mode, you're going to do synchronous. And that's just meaning that the two pads fire at the same time. I wouldn't worry about anything else. Then if you go to set, the ramp, you can leave 1 to 2 seconds still. The on time, it has to be at least double that, but we said we were going to do 10. The off time, we'll say we'll do 30 for 10 to 3, or the 1 to 3 setting. The pulse width has to be at least 250. Let's put it at 300 like we have been.
Is that the same as duration, pulse width here too?
Yes. And then the rate, we'll put at 35 because that's between 30 and 40. Then whatever the treatment time on the study with the SPT guide, go with that. And then you crank it up. Again, you want 50% of the contraction to reduce atrophy, or you want 70% of the contraction to improve strength. Put the pads on, boom, go. Okay, so whenever you have the spasticity component or hypertonicity component, you can have like a twitch or you can have a tetanic contraction. Whenever you have the tetanic contraction, that's when you want the fatigue, versus the twitch, you just want to stimulate the muscle in order for it to then like later relax or get a full contraction. So the pulse for a twitch, you're going to do the symmetrical biphasic. I have it already set up on here. You're going to do less than 10 for the frequency for a twitch. So crank it all the way down to 5, we'll say, because it's less than 10. And then your pulse duration is going to go anywhere between 100 and 400. Why it changes specifically, I'm not entirely sure. Or actually it says 200 to 400. So you can still leave it on 300, and then you're going to make it continuous if it's a twitch. So you just want it firing all the time. It's just going to get the full contraction out of it and get it to hold, because it's going to be firing the whole time. And then the lower frequency just means that it's happening less, so it's longer holds instead of quicker holds. Like instead of going on, off, on, off, on, off, on, off, off, or up and down on the frequency, it's bigger and longer, so you get a stronger hold. But if I need to fatigue the muscle specifically, I'm going to crank this to over 40. So like 45 40 to 50 if I have a muscle that's in spasm, because wow, that went really quick. Because over 40, I'm gonna fatigue. So let's say we say it at 50, I can keep the 300 pulse duration. However, for comfort, I can either leave it at 1 to 1, where it's 10 on, 10 off, or I can make it 1 to 3, 10 on, 30 off. And then the ramp time is gonna be 1 to 2 for the Titanic one. You're not gonna have a ramp for the Twitch one though. So, and I don't even know if it's gonna let me adjust ramp. It doesn't look like I can even adjust it on here, so you don't have to worry about it. And then for this one, I would assume that if I go to the biphasic, to set this up, I can change the ramp here. I can make it 1, that's as low as it'll go. It won't go to 2. So you would set it at 1 for the Twitch, and you can set it at 2 for the Titanic one. And then there's different time frames. I think it's 15 to 60 minutes for both of them. And you just want a sub-max contraction in order to either fatigue it or in order to get it to actually create a full contraction instead of a twitch. I think that's it for that one. So for this would be for the shoulder subluxation or for gait. But specifically for the shoulder subluxation, you're gonna set it up like you would for just a muscle contraction. You're gonna go to the biphasic on the Chattanooga machine, and you're gonna place it at 30 to 50 for the frequency, less than 40 primarily because you don't want to fatigue. And then you're gonna be, again, probably at 300 for the pulse duration or pulse width, because that's between 250 and 400. Hey, I'm teaching, hang on.
Sorry.
All right.
Can I start over?
No, we're good. All right. 30 to 50, but less than 40 for the frequency. And then 250 to 400 for the pulse width, like usual for a muscle contraction. This is saying like 15 minutes for the first time. You can do it up to 6 hours. Your ramp's going to be 1 to 2 again for comfort. That's going to be kind of your go-to for ramp is 1 to 2. And then you're going to place it on the, I believe we did it on the supraspinatus and on the posterior deltoid. And so what you can do is specifically whichever one is on the, if you put your cathode on the supraspinatus and your anode, which would be the black pad, on the posterior delt, and you do symmetrical, then whatever intensity you turn it up to, that's going to be the same for both muscles. If for some reason you're getting too much contraction out of the posterior delt and you want more out of the supraspinatus, you can put it to asymmetrical. That means that the cathode pad or the positive pad, which would be the red one, is going to have a bigger jump in intensity, so it's going to have a higher intensity overall, whereas the anode pad is going to have a lower intensity over that duration, so you're going to get more supraspinatus contraction and less posterior delt. So you can usually turn the intensity up in order to get the supraspinatus contraction without super firing the posterior delt, because it has a lower intensity if you do asymmetrical. But you want to try and do symmetrical because you want them both to work together. I think that's it. You just want a strong contraction with that one. For gait, so if you're doing gait, same parameters as for the sublux shoulder. So this is 0 to 1 seconds for comfort. You can still do probably 1 to 2 for the ramp. You don't want to go over 40 because you run the risk of fatigue. 250 to 400 for the pulse width. And then you want a, typically for this one, you just want a sub-max contraction, so you don't want it maxed out, but you just want a good contraction. And then typically for the gait one, you want the button to where you can actually fire it whenever they walk. If not, I would set it as like 10 to 30, and that way you have 10 seconds to help them through the gait cycle, and then they rest for 30 seconds, or they can take an extra step in that 30 seconds, and then you can redo another step with it firing again. So you just have to time it, which is tough. So you want to try and use the Chattanooga because I think it has the button, if you can, for that one. You don't want an on-off time if possible. If you have the trigger, you're going to set that to nothing if you have the trigger to turn it on and off. If not, you'll set it to 10 to 30. If for some reason, this is going to be with the biphasic pulsatile current on both of them. And so again, if you put one over the nerve like we did with like the fibular head, and then one on the tibialis anterior, and for some reason they're very, very irritated over the nerve and it's causing problems, what you can do is you can make it asymmetrical, and you can put the cathode pad or the red one on the muscle, and the anode over the nerve. And then you can do asymmetrical again, so you'll get more impulse to this pad and less here if it's irritating the nerve too much. So you can mess with the pads in that regard. But what you'd like to do is put the red pad over the nerve and the black pad on it and use symmetrical. But what's gonna happen a lot of times, they're gonna get a lot of tingling into their foot, and it's probably from this pad. So you'll flip-flop them and put the red one down here and put it on asymmetrical, so that way you get a stronger contraction specifically to the muscle and less stimulus to the nerve, so that way hopefully the foot doesn't hurt as bad. As well as just repositioning the pad maybe a little lower or something like that.